I want to ask you a question. Let's say you're out shopping for a therapist. What sorts of qualities would you look for to help you decide, help you determine whether or not that therapist is actually going to be helpful for you or not? Would you look at age, or maybe gender, or the amount of experience they've had, or the kind of education they've received, or what their theoretical discipline is? What qualities would you actually look for? Today, I'm going to teach you what the number one most important factor is in determining whether therapy is going to work for you or not. Hi, I'm Eric, and welcome to My Mental Health World. So what kind of things is my therapist going to actually talk to me about? And will he or she even like me? What kind of experience do they have, and what kind of education do they have? Are they going to be able to relate to me? Do they practice a particular brand of therapy? I hear there's all kinds of different brands of therapy out there, and are they too young for me, or are they too old for me? So these are the kinds of questions that you might ask if you're looking for a therapist, right? And especially if it's the first time that you're going to a therapist. Very natural, common sorts of questions. But it's important to know which ones actually make a difference and which ones don't, right? Not just for the outcome of the therapy, but also for your pocketbook. What makes therapy work? That's what we're going to talk about. And truthfully, we could spend a lot of time diving deep into the discussion on this. But for today's sake, we're going to try to condense it down to a few quick, pragmatic ideas that you can use. Actually, the answer in terms of what works in therapy, it's simple. It's you. Believe it or not, research shows that the most important factor in determining whether or not therapy is actually going to work is what you bring to the table. If you feel really good about your therapist and where your therapy is going and why and what you want to change, then the chances of your therapy working are going to be much, much higher. Does that surprise you? Traditional models of therapy have typically involved the client deferring to the grand expertise of the therapist or the doctor. It's a very classical idea, a very Freudian kind of thing. That's an approach that works much better in more medical sorts of disciplines, right? Like gastroenterology or nephrology or cardiology or oncology. But that's not the case in mental health, in therapy, where your perceptions and your experiences are really the most important part of the whole thing. Now, it might be hard to wrap your head around, right? That you might be the most important part in determining the outcome of your therapy, right? Because very commonly we see images of therapists and psychiatrists and psychologists. They really do present themselves, at least in the media, as being the experts. They sit on the chair where you lie down in a submissive position on the couch, and they interpret your dreams, and they analyze your thoughts, and they tell you what's wrong with you, and then you hope that they can come up with something that will fix you, right? I mean, that's kind of how it works. But that's a very medical model, and it's a very, like I said, traditional model. It's not the way things really work. It's not what really matters. What are the factors and variables that don't matter when it comes time to determining whether or not therapy is going to be effective? Well, guess what? It's all of those variables that most people look for when they go shopping for a therapist. Things like the therapist's age, or the therapist's gender, are they male or female, or how much education they've had, how much training they've had, what kind of experience they've had, what kind of supervision they've worked under, what's their professional discipline, what theoretical orientation do they follow. The bottom line is these factors, these variables, are only going to be as important as you let them be. For instance, if you think that age is really an important component to making your therapy work, connecting with your therapist, then certainly that is going to influence the outcome of your therapy. Same with level of education or gender or level of experience. If you really put emphasis on these, if you really believe that these are going to be important qualities that it's going to make your therapy work, then it will, at some level, dictate and determine how effective your therapy is going to be. Again, it's what you bring to the table. It's your perceptions of whether or not therapy can work and how it will work and what your therapist is like and whether or not they're effective. It's your perceptions that really, at the end of the day, are going to determine whether or not therapy will be effective for you. Because when you think about it, good therapy doesn't necessarily have to come from psychologists or counselors or social workers or whatever. Good therapy can actually come from friends and family members and policemen and parents and teachers and ministers and even the bartender down the street, right? Am I saying that models of therapy like cognitive behavioral therapy or DBT or psychodynamic or behavioral or solution focused, that they don't work? I'm not saying that at all. We'll talk about that more in an upcoming episode. All right, that's it. So I want you to understand that the most important factor in determining what works in therapy has nothing to do with the therapist's age or gender or level of education or type of experience or amount of experience or type of supervision or theoretical orientation. None of that matters. What matters most is what you bring to the table, the level of engagement that you're going to bring to the table. That's the number one factor in determining whether or not therapy is going to work. Plain and simple. So if you have any comments, questions, or complaints, you can email me at ericmentalhealth@gmail.com. That's ericmentalhealth@gmail.com. You can also subscribe to this channel by clicking the subscribe button below. Oh, just one more thing. The information provided in this video and all my videos is intended for educational purposes only. It's a resource. It's not intended to be a substitute or an alternative for licensed professional expert advice. If you or someone you know needs mental health help, please consult a licensed professional, an expert. And as always, if it's an emergency, call 911. Thank you for watching, and thank you for being part of my mental health world. We'll see you next time.